I think I'm live. Yeah, that's good. Whoops. Okay. Well, first time here, guys. We're working it out. Let's see. Can you, when you come back, can you grab my Unimate? Thank you. Hi there, guys. This is a trial run. This is new for me. And I'm excited. I'm really excited to do this. I am going to be addressing a very big problem that we have worldwide, but in the United States, I live in the United States, and that I think we don't talk about enough. And a little bit about me. I am a dentist. My name is Dr. Gagliano. Long name, hard to say, so a lot of people call me Dr. G. And I have been a dentist for 30 plus years. I've seen a lot. I've watched a lot happen. And part of this healthcare system is something that I've watched more and more medication be prescribed and people getting sicker and sicker and sicker. And it dawned on me that there's more going on, and I wanted to find out what that was. So, what I'm going to talk to you about is what about your metabolic health, but also how that ties into you and your oral health. So basically, how does dentistry and medicine come together? How is connected? Well, everything is connected. Okay, and that's why this presentation is called "From Gums to Gut: Supporting Your Metabolic Health," and basically how everything is connected. If we do not have a healthy mouth, we certainly do not have a healthy systemic system. Our metabolic health suffers if we have a oral health that is not healthy. By protecting your oral health, you are able to protect your entire body's health. A lot of times we don't think of it that way. We think of it as a separate thing. When you go to the dentist, oh, it's just a cavity, or oh, it's just my gums are just bleeding. We don't think about it that way. Thank you. Appreciate that. Are you able to see that?
I can't. I'm going to do this right here so you can see. Anybody makes a comment,
Oh, look at that.
you can go to your chat. Welcome everybody that's in there so you can see it and you can respond to it.
Well, thanks. I appreciate that. Yep. So I'm not sure. I'm learning. I'm just learning. So if I miss your comment, if you have a comment and I miss it, I do apologize. Hopefully I can go back. But what I'm going to be talking about is From Gums to Gut, metabolic reset, how your oral health affects your overall health. And what I was saying is that, we often go to the dentist and it's like, oh, it's just a cavity, or, oh, it's my gums just bleed. It's no big deal. Well, it actually is a big deal. Okay. Because it can lead to a lot more stuff going on than we actually realize. Alrighty. Well, let's get into it. So I have several quotes that I love. One is from Hippocrates. It is basically, let food be thy medicine, let medicine be thy food. And here's another one. The doctor of the future will give no medication, but will interest his patients in the care of human frame, diet, and in the cause and prevention of disease. Basically, I love this because it focuses on prevention, not medication. And that's what I'm going to be talking about today. We are, as a society, we want to just medicate. We want to just give a pill and send you on your merry way. And it's not about that. Medications only, they just, treat the symptom. They only manage. They are not healing anything. Okay. One of the things I want you to remember is that if medications were working, you should not need a refill. Something more is going on. Okay. So let's dive into it. So, yes, there is an oral systemic connection to heart disease, high blood pressure, Alzheimer's disease, diabetes, to name just a few. There is an oral systemic connection to your metabolic health. Well, let's talk about what is metabolic syndrome. What is your metabolic health? What is it made of? How do we find out about it? What are the risk factors? So, there are five risk factors. There are five symptoms, basically, of metabolic syndrome. It is a cluster, not just one thing, but a cluster of things. And if you have three or more of these things and they are measurable, then you more than likely have metabolic syndrome and you are at risk for having um, um, problems with your metabolic health. So basically, if it's your blood pressure 130 over 80, if it's 85, if it's greater than that, if you have high triglycerides over 150, if for a man you have your HDL cholesterol greater than less than 40, for a woman if your HDL cholesterol is less than 50, also, a fasting blood glucose of greater than 110. And if your waist is more than half the circumference of your waist is more than half your height, and that looks like basically greater than 40 inches in a man and greater than 35 inches in a woman, you more than likely have metabolic syndrome. Now, if you have to be medicated in order to keep any of these in check, then you are more than likely um, helping your body to not progress to something further, but you more than likely have metabolic syndrome. Uh, and the thing is, you are not alone with this. 95, no, excuse me, 93% of Americans are not metabolically healthy. And what that looks like is if you are going to work today or you're coming home from work and 10 cars pass you, nine of them are sick. And they most of them don't even realize it. Most of them aren't they don't even know it, and you could be one of those. So what is this? I call this the plagues of prosperity. And what this is, basically it's talking about, uh, and addressing the root cause. Well, what is it? So we talk about diabetes and stroke and heart disease and dementia and periodontal disease, and we talk about Alzheimer's disease and arthritis and things like that, PCOS, erectile dysfunction, migraines, all those things. But when you go to the doctor, they're going to treat you individually for each one of these things. The thing is, they all are linked and they all have one root cause, and that root cause is insulin resistance. And when we talk about how to address that, things start to change. But things don't start off as high blood pressure, things don't start off as cognitive decline, things don't start off with fatty liver. They progress to that. Alrighty. And the other thing that, I want to talk about is this did start off 10, 15, even 20 years prior to we get that diagnosis of high blood pressure or migraines or dementia, or things could be going on behind the scenes that we don't even know about. And next thing you know, we're diagnosed with heart disease. So, how does that happen? Let's first talk about what insulin resistance is. Insulin resistance is when it's not that your insulin's not working, it's when the receptor on the cell is not working. So let's talk normal. Normal things that occur when we eat our food. Our blood sugar goes up. Well, it turn our that glucose from our blood sugar needs to get in the cell to provide energy. That glucose is able to get in the cell because insulin then is secreted by the beta cells of the pancreas. And when insulin is secreted, it then it's the key that unlocks the receptor to allow the cell to have glucose enter. When glucose enters, utilizes the cell utilizes it for energy, and basically then that's how the normal bodily processes work. That's how your cells get energy. But with insulin resistance, what happens is the Insulin, which is the key, is not able to unlock that receptor. There's nothing wrong with your insulin. There's nothing wrong with that. Basically, your cells are full. They are full of glucose. They don't want anymore. They don't need anymore. So have they don't allow that key to open the lock to allow the glucose to come in. Well, insulin still has a job to do. It has to find a place to put all this glucose. So it enters into your bloodstream, and it can then further go and start being deposited in your organs. It'll bring it to your liver, your kidneys, your heart, your brain, your skin, things like that. And over time, that's when we start to see all those things that start to happen. Little by little, you start to get blurred vision, or you become very thirsty. You also seem to always have cravings, food cravings, increased hunger, things like that. Never can get full. Your skin, you start to develop dark patches or skin tangs, even. Your blood sugar then rises, but you also then may develop migraines or tingliness in the hands and feet, some type of neuropathy, overall inflammation, chronic pain, things like that. And when these things start happening, you have difficulty losing weight sometimes. That's why calories in, calories out doesn't work. It has nothing to do with math. It's not a math problem. It's an insulin where this hormone is responsible for fat storage. As long as insulin is high, you're not able to burn fat. It's going to store your glucose as fat. So these are those skin tags that I was talking about. You'll start to see them on your neck. You'll start to see them under your arms. All of a sudden you'll start to get increased body fat around your waist. That's that visceral fat. Okay. So what is this? Like what happened? Basically, how did we get here? It's a global epidemic. Okay? It's a global epidemic, and it does not discriminate. Metabolic syndrome is something that leads to chronic disease, chronic systemic disease. There are 589 million adults in this world that have diabetes. Diabetes alone. 30 million are in the United States, and one in four of them don't even know it. Okay, and that is a 2022 statistic. So I believe it's 38 million now. 86 million have prediabetes, and most don't even know it. And this was not the case. This was not the case um, in 1980. In 1980, there were 0 cases of adolescents being diagnosed with type 2 diabetes. Now we're seeing it, that it's so very common. I would see it in my practice that it's becoming more and more common to be diagnosed with type 2 diabetes. Um, it used to be associated with those over the age of 50 or 60. Now we're seeing 20-year-olds. We're seeing 20-year-olds or even younger diagnosed with type 2 diabetes. By 2050, um, let me go back to the very first slide. By 2050, 35% of Americans will have diabetes. That's 1/3 of the American population. And despite statin medications being the number one prescription drug prescribed for heart disease continues to be the leading cause of death in the country. So something else is going on. There's more going on to this than just that. Remember, if medications were working, you wouldn't need a refill. So what is it? What's the problem? Well, the problem is our food. The we Our diet, and it's filled with bottles, boxes, and barcodes that are filled with processed foods and ultra processed foods. And if you don't know the difference between those two, um, let me know. I will, put a question in the chat, and I will definitely address that question. But basically, it's our food, it's our diet, And hopefully, what we can do is fix that with the new food pyramid. But what's going on? So with our modern diet is we eat all the time. We're eating all the time. Every couple of hours, every 2 to 3 hours, we need to eat. We first start off with breakfast, then we eat a snack, then we go to lunch, we have a snack, we have another late afternoon snack. Then we have a big dinner. We have, because we feel we deserved it, we had a bad day, we're going to have another dessert right after that with another snack. The problem is with eating all the time, what happens is your body is constantly having your insulin levels high because every time you eat, you elicit a glucose spike, which then insulin then comes in to meet that spike. So you're constantly having insulin that's always high. The problem also is our food. A long time ago, our food, wasn't like it was today. We had a lot of fiber, but now today our food is stripped of the fiber. Apple juice, what was it? Apple is now apple juice. Well, that's stripped of fiber. Rice um, usually has the bran and all that stuff and on it. It's now stripped of its fiber. White rice is stripped of its fiber. It has elicits the highest spike on the glycemic index. So when we wake up, we are in a fasted state, believe it or not. Your glucose levels are low, but as soon as we eat breakfast, we elicit that glucose, that spike in our glucose, and then insulin then has to come and help get that glucose under control. And then as long as we're eating throughout the day, we never allow our insulin levels to fall. So what happens? We're swimming in insulin. We are swimming in insulin. And it's like I said before, with this old food pyramid, um, it was having us eat every 2 to 3 hours, heavy grain diet, heavy carbohydrate diet, and now that the food pyramid has been changed, it focuses more on whole foods, not on whole grains, whole foods, proteins, good healthy fats, dairy, things like that, and vegetables and fruit. Because over the time that I was eating with the old food pyramid, I began to look like the food pyramid. So I'm glad that the new one is uh is now out there. But what happens is, you do all this right. You think you're doing correctly and making sure that you're eating right, making sure you're doing all the things right. But you go to the doctor and he says you're all good. Your A1C is great, your blood pressure's great, your cholesterol's great, but you don't feel good. You don't feel good. And something's going on because you're starting to have inflammation, you're starting to have aches and pains, you're always tired, your hair is getting thinner, your skin is not the way it used to be, you have migraines, you have joint pain, something's happening. You just don't feel good. But everything looks fine. I call this the land of aggravation. It's frustrating too because it's frustrating for you, it's frustrating for your doctor, because something's going on, but no one can seem to figure it out. Well, what is happening is that while they're doing all these blood tests and they're checking for your A1C, there's one value that they're not checking, and that is your fasting insulin. With fasting insulin, that's going on behind the scenes. They don't check that. So while your A1C looks like it's normal, and it is normal, things are going on behind the scenes. That while you're not a pre-diabetic just yet, you're still not out of the woods yet. Okay. It may be between, maybe it's a 5.7. But if you're between a 5.0 and a 5.7, you still have a 30% increase in a cardiovascular risk. Okay. So I'd stated earlier that statins are the most prescribed medication that is for heart disease. But despite that, we still have that as the leading cause of death. Well, back in 2013, this article was published that they changed the guidelines for the prescription uses on a statin and how to go about prescribing it. Adults 40 to 75 years of age with an LDL cholesterol between 70 and 189 and no history with diabetes or cardiovascular risk. As a precaution, what they wanted to do is they suggested to be put on a statin, which is why I saw so many people come into my practice on statin medications, and they were at a younger age than ever before. Yet they were still not getting any better. They were actually getting worse. So what this leads me to talk about is polypharmacy. And like I had said before, if you go to your doctor and you have a migraine or you have IBS or you start developing heart palpitations or you are a pre-diabetic, they're going to put you on a medication for each one of these things. And that's polypharmacy. It's a pill for every ill is what I call it. And since the statin medication is one of the number one prescribed medications, is the number one prescribed medication. We're going to start there. So this pharma loop is just an example. It's an example of what can happen. It's an example of what I saw happen. So I want to just address this. And more importantly, is when you're prescribed medications are not prescribed without any side effect. There are side effects to these medications, and they often contribute to other diagnoses. And I'll show you what I mean for that, with an example of this. So you're put on a medication because you're diagnosed with high cholesterol. And then over time, you develop prediabetes. So they give you the number one medication for that is metformin. Okay. Keep in mind, these medications are only managing your symptoms. They are not addressing the root cause of insulin resistance. Then over time, you're put on lisinopril and HCTZ and gabapentin because you develop a high blood pressure and a neuropathy. Okay. And then time goes on, you start getting acid reflux or something, even a little, you just get hot burps, things like that, GERD. And then you begin to gain weight. You don't know why. That leads you into some type of anxiety, depression. You develop a arrhythmia. And the next thing you know, you are then diagnosed as a type 2 diabetic. Now, this can go on for years. This can all be diagnosed in 1 year. It depends on your body. It depends on your body chemistry. But what's happening is when they give you that statin, they didn't mention that one of the side effects, there's many, one of the side effects of a statin is insulin resistance, which causes type 2 diabetes. So they put you on metformin. And then they didn't tell you that metformin has a side effect that it affects the absorption of vitamin B12. Well, vitamin B12 is very important because without vitamin B12, your nerves are not working properly. Well, if you don't have B12 and it affects that absorption, then you develop neuropathies, okay? Then as time goes on, you develop gut issues with all this stuff is going on because you continue to eat the same diet that you always had. You start to develop that acid reflux is why you needed that omeprazole, that proton pump inhibitor. And that leads to anxiety and depression because what happens is those PPIs affect your gut microbiome. And with your gut microbiome out of whack, that's where most of the neurotransmitters and also some of your hormones are produced. Well, if the neurotransmitters of serotonin and dopamine aren't produced like normally, that contributes to anxiety and depression. Then you are faced with a cardiac arrhythmia. Another side effect of statin medication is decreased production of CoQ10. CoQ10 is responsible for keeping your muscles working the way they should. But if it's decreased, then you get muscle soreness, you get fatigue, and you get an arrhythmia. Another side effect of a proton pump inhibitor, that omeprazole, and another side effect of that statin drug, again, insulin resistance that we talked about earlier. Proton pump inhibitors have insulin resistance. So then the next time you go in, Your numbers come up, your A1C then shows you are a type 2 diabetic, and they want to put you on Ozempic because you're already on metformin. This is one example of a pharma loop of polypharmacy. Just one example. Now I want to be clear. I am not anti-drug at all. I'm a prescriber. I believe there's a time and a place for antibiotics. I am anti-pharmacy. And the reason why is because one medication leads to another. If medications were working, you should not need a refill. Keep remembering that, okay? A pill for every ill. So, what's the oral systemic link? You're probably saying that's all fine, that's all dandy. What's the oral systemic link? Well, tooth infections, periodontal infections, mouth infections can spread through your bloodstream. They can reach your heart, your brain, and other organs and cause lots of problems, okay? As far as periodontal disease, there is a link between periodontal disease and systemic disease. Those patients that were diagnosed with diabetes and heart disease, along with Alzheimer's disease, had the same bacteria that caused periodontal disease. It's called Porphyromonas gingivalis. Big long word. We call it P. gingivalis. It's one of the many pathogens, periodontal pathogens, but it is the biggest guy, the biggest, one that causes the most problem. That was found not only in the blood of diabetics and those that had heart disease, those patients that had heart disease, but it was also found in those patients, the brain of those patients with Alzheimer's disease. How does this happen? You're probably going, I don't understand. Well, as far as when we eat our food, and we have three macros. Let's talk about that first. There's proteins, fats, and carbohydrates. Carbohydrates are digested in the mouth. They're broken down into simple sugars. Fats and proteins are broken down in other parts of the body, the small intestine, the stomach. So for our purposes, we are talking about carbohydrates. So digestion of carbohydrates begins in the mouth. They're broken down into simple sugars by salivary amylase. It is a enzyme in the mouth, in the saliva, excuse me. And what that does is it breaks them down into simple sugars. And the bacteria of your mouth, your natural oral microbiome, okay, just like you have a gut microbiome, you have an oral microbiome. Those bacteria of the oral microbiome love those simple sugars. And then what they do is they produce acids and plaque as their byproducts. Plaque is that white fuzzy stuff on your teeth. If you rub your teeth with your tongue right now, you probably can feel it, okay? When that plaque sits on your teeth, that's what contributes to a cavity. But also, the longer it sits on your gums, the more inflammation develops. And that's when leads to gingivitis and then leads to periodontal disease. So if it's not brushed away in a timely manner, this can go on. Now, as we eat, more and more plaque develops because more and more of the bacteria consume the simple sugars, okay? What happens is with this inflammation that develops with your gums, alrighty, your body looks at it like it is a result of a site of injury. And this injury signals the body that it needs to protect it. So it sends out cytokines and white blood cells and all the things to help fight this injury. Over time, though, the inflammation gets worse. And what happens is the pro-inflammatory cytokines, the P. gingivalis and its byproducts, they disrupt the insulin pathways. And then they enter the bloodstream because if the insulin pathways are not allowing the cell to have glucose enter, then it's got to go somewhere. And what happens is there's increased blood sugar, there's increased insulin, and there's increase of these pathogens in your bloodstream. Well, how does that affect high blood pressure? How does this affect systemic disease? Well, let's talk about diabetes. With diabetes, what happens is the inflammatory cytokines plus the bacteria and its byproducts, okay, enters the bloodstream. All righty. It blocks those insulin pathways. And that way, even if insulin wanted to work, even if insulin wanted to find its way to open up that cell to allow the glucose in, the pathogens from the P. gingivalis, it's called a gingipane. And basically those gingipanes block that receptor site. All right. And one of the things that I want you to remember is with these pathogens, um, there's many. However, this is the main one. P. gingivalis is the main one. And the gingipans break down the proteins and the nutrients. They dodge those immune cells, they destroy tissues, and they spread infection. And with diabetes, you are already immunocompromised. So you are more susceptible to infection. So what happens is these gingipans disrupt that insulin receptor on the cell. They cleave to it, they block it, and they cause the diabetes to get worse. Okay. So when it's blocked, you have a buildup of more blood sugar, you have or glucose in your blood plus insulin, okay? And it just continues on and on. Now, with high blood pressure, what happens is these gingipans and along with the P. gingivalis bacteria and the pro-inflammatory cytokines, they are in the bloodstream, okay? And what they do is the endothelial cells of the lining of your blood vessels, they normally will produce nitric oxide. Nitric oxide is very important with your blood cells. It allows, your blood vessels. It allows your vessels to dilate. It's really important for them to dilate because that allows the blood to flow freely. That allows your blood pressure to come down. It allows your heart to pump correctly the blood through the system. But what these gingipanes do that are produced by P. gingivalis is they disrupt that signaling with the endothelium inside the lining of your blood vessels. So what happens is the blood vessels cannot produce that nitric oxide. Without nitric oxide, there is no vasodilation. The arteries, or the vessels become rigid and stiff, and they're not able to pump this the blood correctly through your circulatory system. So what happens is then with with an increase of insulin and an increase of blood sugar, obviously in the bloodstream, insulin signals to the kidneys to hold on to sodium. Where sodium is, water will follow. So you have an increased amount of liquid in this closed system. It's kind of like when you plug up a garden hose, but you keep turning on the faucet. And eventually, this leads to high blood pressure. All right. Now, with Alzheimer's disease, what happens there is that these pro inflammatory cytokines, along with P. gingivalis and the gingipans, they enter the brain. And the way they do that, they're in the bloodstream, but they cross the blood brain barrier. And when this happens, those gingipans, they begin to slice up those brain proteins, like the tau protein and the amyloid precursor protein. It's called APP. And this causes clumping and swelling of the brain tissue. That's where we get those beta amyloid plaque formations and those tau tangles. And those lead to neuronal death, which then leads to cognitive decline and leads to Alzheimer's disease. So one of the things to remember, I'd like you all to remember, is there is no human condition made better by poor nutrition, and there is no human condition made worse by better nutrition. If you have any questions, make sure you just put them in the chat. I will get to them if I don't see them, and you can always contact me at my link tree at drghealth.info. It has all of my socials on it. Always can call me or access our website